Child welfare officials have launched an internal review following the death of 4-year-old Jahmeik Modlin in Harlem earlier this month.
Jahmeik's family filed a $40 million negligence lawsuit against the city for failing to protect the boy, and he's one of 4 children who have died since July. Child welfare advocates say the Administration for Children's Services has failed these children. So this morning, we're joined by the commissioner of the agency, Jess Dannhauser, to address these concerns. So good morning, Commissioner. Thanks for taking the time to talk to us about this very upsetting topic, to be quite honest. Multiple investigations going on right now to determine how the city failed this little boy. I mean, ACS is conducting an internal review. The state attorney general also investigating the case. Where do we stand right now with this investigation?
So when a child passes in such a heartbreaking way, and this is awful for our city, awful for the community, for a child to likely have starved in our city, we take that deeply seriously as a whole community, as a city, to make sure that we are getting it right. Our first obligation is to surviving siblings, to make sure that they're safe, to make sure that we are protecting them. Often you can see things many years later on social media if we say the wrong thing about the case. There's also really important decisions playing out right now in family court, there's criminal court, there's investigations, but we will be doing a deep review. We'll be making sure the state is also, every time an incident like this occurs, the state does an independent review of our work, and they'll publish those results typically within 3 to 6 months. So all of this will be carefully vetted. I think that our teams every day are going into homes. We respond to about 50,000 calls a year. We have extraordinary women and men who do this work, and they would never leave a child that they believe to be in danger and harm's way. My job is to give them all the tools that they need to support families and to protect children.
As a mother reading this indictment, the warning signs are alarming. It said in the indictment that the fridge was allegedly turned the other way. There were locks on the cabinets. When Jahmeik passed, the medical examiner said he was 19 pounds. He is 4 years old. He has 3 other siblings who are in the hospital treated for malnutrition. These are all warning signs. How did the social worker miss those signs going into the home?
So I can't speak to the investigation at this time for the reasons I just laid out. I want you to know that we need to make sure families know how to turn to us for help. That too many families are socially isolated. We have to have a system that they trust, that they can turn to. I want folks to know they can call 212-676-7667 to get the support they need. We have a dedicated page, nyc.gov, for families. We have to make sure families are not isolated in their communities. The Surgeon General put out a warning that families are very stressed. Our job is to make sure that we're working with all of our community partners to make sure families can trust someone to turn to. I'm not going to say too much more about the investigation that we're looking into, that we'll have the results of that, but I think a big part of it here is that the family was isolated.
What you're saying is, though, is the problem, is the crux of this case. This family is saying that they did reach out and ACS did not help them. Social workers came to the house, they're saying, and didn't see these signs. This mother said she was dying for help and didn't get it.
Yeah, I don't want to get into a discussion about the family there in mourning. I really wish them well and pray for them. I'm sorry for their loss. We have to make sure we understand all the facts of this case before we publish any results. But I will tell you, I work with some of the most extraordinary women and men who go into homes every single day to try to get it right, to try to make sure that we are protecting children, that we're supporting families, and we always work to get it right. We know we can't go back to the days of the past. Child welfare pendulums have not protected children. We have to keep going deeper to get services and support to families, and when children are in danger, to act decisively.
Yeah, I mean, it's hard for though, as you can imagine, for this family. Apologies don't carry a lot of weight considering they just lost this beautiful little boy. But they were on the radar, like she said, in 2019. The case was closed in 2022, and that's when ACS kind of changed the strategy on how they dealt with families. Can you explain what that change was and maybe how maybe there needs to be another change with the system?
We haven't changed strategy. We are responding in 24 hours to all calls. Today I'll be in ChildStat with our team, making sure that we're learning every week. We are getting stronger and stronger. What we're doing is adding more resources to the toolkit of child protective specialists, to families to get support. That's what our family enrichment centers are all about. In the coming days, we'll be issuing an RFP to get strengthened consultation for our child protective specialists around domestic violence and substance abuse and mental health issues. We're continuing to build that toolkit. I've deployed my highest level child protection leadership out into the boroughs. We've invested in leadership. Our job is to keep getting stronger and stronger so we can prevent things like that. And it's a multifaceted strategy. You have to, like in medicine, you have to make sure you understand and assess what's going on and then bring the right tool to bear.
What Hazel was referring to, I think, was the CARES program, that changed. But also, we want to talk about the amount of social workers that you actually have. There's about 1,000. There are reports that the average caseload is 9. There are reports that they are as high as 15. What can you say about that?
Yeah, the average caseload today is 8.3. One of the things that we look at in ChildStat is the number of CPS who have caseloads that are above 12. That's the national standard, right? Because averages can be elusive and someone could have a higher caseload. 98% of our child protective specialists have a caseload of 12 or below this morning. We've hired hundreds of new child protective specialists. We actually have about 100 more active child protective specialists this year than we had this time about 18 months ago. It's a real focus of mine. We have ad campaigns coming out. We have to make sure that we're bringing in the best and the brightest. We train them over 8 months. So they have a series about a month and a half of training in the academy. Then they go through the training units. There's specialized supervisors who help train them up. They have lower caseloads, and we get them ready to do this job.
In this city, we've had 4 children die since July under ACS care. In your words as the commissioner, what can ACS do better?
We have to continue, as I'm saying, to go deep. Those circumstances of each of those are very different. And sometimes, if I could share information, it might relieve some public pressure. My job is actually to protect the surviving siblings in those instances. We assure the public that we will be looking deeply, but they can also be assured that the state is looking at this. We have to make sure we can decipher. The medical examiner is still continuing in some of these cases, whether it was an accident, whether something went wrong, that they ingested something, or whether someone committed a horrible act to a child. Those are the things we have to learn from day in and day out.
Well, ACS clearly under the microscope, so we appreciate you taking the time to address these questions.
Thank you for having me.
Thank you so much, Commissioner.